Middle ear infection otitis media. About middle ear infections. Otitis media is an infection of the middle ear that causes inflammation, redness, and swelling, and a buildup of fluid behind the eardrum. Anyone can develop a middle ear infection, but infants between 6 and 15 months old are most commonly affected. It's estimated that around 1 in every 4 children experience at least one middle ear infection by the time they're 10 years old. Symptoms of a middle ear infection. In most cases, the symptoms of a middle ear infection otitis media develop quickly and resolve in a few days. This is known as acute otitis media. The main symptoms include earache, a high temperature, fever, being sick, a lack of energy, slight hearing loss if the middle ear becomes filled with fluid. Hearing loss may be a sign of glue ear, also known as otitis media with effusion. In some cases, a hole may develop in the eardrum, perforated eardrum, and pus may run out of the ear. The earache, which is caused by the buildup of fluid stretching the eardrum, then resolves. Signs in young children. As babies are unable to communicate the source of their discomfort, it can be difficult to tell what's wrong with them. Signs that a young child might have an ear infection include pulling, tugging or rubbing their ear, irritability, poor feeding or restlessness at night, coughing or a runny nose, diarrhea, unresponsiveness to quiet sounds or other signs of difficulty hearing, such as inattentiveness, loss of balance, when to seek medical advice. Most cases of otitis media pass within a few days, so there's usually no need to see your GP. However, see your GP if you or your child have symptoms showing no sign of improvement after 2 or 3 days, a lot of pain, a discharge of pus or fluid from the ear. Some people develop a persistent and painless ear discharge that lasts for many months, known as chronic suppurative otitis media. An underlying health condition, such as cystic fibrosis or congenital heart disease, which could make complications more likely. How middle ear infections are treated. Most ear infections clear up within 3 to 5 days and don't need any specific treatment. If necessary, paracetamol or ibuprofen should be used to relieve pain and a high temperature. Make sure any painkillers you give to your child are appropriate for their age. Antibiotics aren't routinely used to treat middle ear infections, although they may occasionally be prescribed if symptoms persist or are particularly severe. What causes middle ear infections? Most middle ear infections occur when an infection such as a cold leads to a buildup of mucus in the middle ear and causes the eustachian tube, a thin tube that runs from the middle ear to the back of the nose, to become swollen or blocked. This means mucus can't drain away properly, making it easier for an infection to spread into the middle ear. An enlarged adenoid soft tissue at the back of the throat can also block the